So I'm going to tell you a story today about one of my patients. This is a real common story. This is about a patient I'll call Paige. She was 52 when she came to see me. I see a lot of women for menopausal symptoms. At 52, you'd be expecting to have menopausal symptoms. But as she told me her story, she said she's been having these symptoms since she was age 34. So I said, that's unusual, obviously. Normally menopause starts around age 50. You're 52. What happened? And she said, well, I had severe endometriosis for years, severe cramping and pain and bleeding. And doctors found out it was endometriosis. So they said, you need to have your uterus and your ovaries removed. So she had a total hysterectomy, removed her uterus and both ovaries. And that immediately throws a woman into menopause. She didn't really even know that. Now she's at 34 and she's having hot flashes, severe hot flashes, day and night. And now she can't sleep. She's a mess. If you go a few days without sleeping, you are just wiped out. And it starts to affect your mental cognitive function. She gets depressed. She gets anxious. So she had anxiety and depression. She had fatigue that was severe. She started having headaches, migraine type headaches. Then she started having severe vaginal dryness, which led to severe painful intercourse. And she was already having a lower sex drive, not very much interest, because when you have your ovaries removed, you also lose testosterone. So she was having all of a sudden no libido and now a fear of having intercourse because she's got severe pain. And so all these symptoms, she just had no idea how this, she got this place so early in her life. So she went back to the doctors and got on an estrogen, which did seem to help a little bit, but it's the prescription estrogen, which doesn't give her full, complete relief of all her symptoms. So she feels a little bit better. She's glad for some help. Didn't stop her headaches, actually made her headaches worse. It seemed to not give her any significant relief for the vaginal dryness. Didn't eliminate it. By this time, she's gaining weight. She started gaining more weight when she got on the estradiol. She's having joint pains now. So over these years, she just keeps getting worse, and she just thinks, I'm just aging, and I just got to suck it up and kind of endure this. But it just basically was ruining her life. Now she's getting to me. She's saying not only that, but now everything is sagging and wrinkling. All my skin, my joints are aching. Things I wouldn't have expected even with menopause. So this is kind of a real typical patient that I see. She's like, I'm her last hope. She's been to several doctors. She keeps going, looking for new answers. Her husband's beside himself trying to help her and their relationship. And, they don't have the intimacy they used to have. She can't think clearly. They still love each other, but they just missing the bonding that they normally would have. She's, in pain emotionally and physically. And she's looking at, I'm just now 50. And am I going to have this problem for another 20 years? I can't do this. So finally, somebody tells her, you need to see Dr. Hansen. I had similar symptoms and I am feeling great now. So that's a typical story. I was able to tell her, yes, I have seen this a lot. It's not that uncommon. You're not alone. It's like you are, actually pretty common story. Having the endometriosis early and having hysterectomy so early really pushed you obviously into menopause earlier, but you're having all the symptoms of all the hormone deficiencies. And I was able to tell her, you don't really get all these symptoms just because you're getting old. Obviously, it's a hormonal issue. You age because your hormones are declining, not because you're 1 year older. And if we will test your hormones. We'll find out exactly where the levels are, and we can then give you a hormonal, bioidentical hormone that replaces the ones that you're deficient in. They were cut out, so you can't just wish them there. You need to supplement them in order to build them back up. And the estradiol is just one of 9 that we look at. And you need all of these hormones in balance. Just one is out of balance, it creates all the rest to go into imbalance. So she was finally getting hopeful. And so we did a test. We test all 9 key hormones, and then we have the patient come back in and review all of that and explain exactly what's going on to them. So it's a big relief to, number one, find out, okay, there's hope again, and maybe we can get this fixed. And now they have to wait a couple of weeks to get the test results because there's not a whole lot of labs that do accurate testing. So we send it off and get it tested and then have her come back in. So this patient Paige also wanted to let me know that these symptoms that she's been having had really messed with her emotions. And she wanted to find out if this was normal, if this was the way everybody felt, because she started so early. It really made her self-conscious and self-aware, and she started having feelings like, I am just old. And so she didn't even see herself as the same anymore. And so at age 34, you're thrown into, now you're 50, basically. And so literally her mind jumped ahead. So she's feeling 15 years older, or 16 years older. And that really affects her activities. And then she's having, such headaches and symptoms that it just messed up every aspect of her life. So she wasn't as social anymore. She didn't want to go out with her friends. She wasn't as athletic anymore. Everything was a stress and a worry, and increased the headaches or increased pain in the joints. So it really took a whole toll on every aspect of her life. So when we got the hormones back and looked at the test, sat down and went over all the results, it takes 2 weeks. So we got her on the treatment, and then we have them come back in a month to reevaluate, see how they're doing. And she said she was like a different person. She could not believe. She said, it's like I'm back. It's like I'm back to 34 again. And she didn't really think it could even be that good. She was on some hormones. She was on a prescription synthetic estradiol, but it wasn't providing the relief for her. She came back and she said she had interest again. She wasn't apathetic anymore. She wasn't depressed. She had energy and excitement, and she wasn't having any pain with intercourse anymore. So she had a bond with her husband again. And she said it was like amazing. She was a totally new person again. So I got a quote in here from her I want to share. So when Paige came back at 1 month, so I go through a litany of questions to see, okay, how are things? Are they better? She was just jumping up and down trying to, tell me how much better she was. But she said, I feel more balanced emotionally, less tearful, more energy. My joints aren't stiff any longer. And so I said, and is your sex drive improved? And she said, oh, yes. She said, it's way up. She said, I have a really healthy desire now and more sensitivity. And it's like she had forgotten what it's even like. It was like she's a new person again. And that was her word. She kept saying, I'm like a new person again. And so it's a thrill for me to see this kind of a change in people's life, because it makes such a huge difference in their emotions. She's not apathetic anymore. She's able to get out and do things. And that brings back the bonding with her husband in social situations and her friends, as well as the intimacy with her husband. That bonding will actually make her live longer. All these hormones will actually make her live longer. And that's my goal, to give them a sense of feeling more vibrant and have more energy and excitement in their life, vitality, and also prevent heart disease and cancer. And these hormones, because they're bioidentical and they're balanced, they actually prevent future risk of heart disease and cancer. Two of the greatest things you can have as a protection. So yes, and then we had her come back at 3 months, and it was getting better. It still was getting better. And we retested 3 months to see if the hormones are back in line. And then we had her come back in 6 months after that. So it's been 9 months now from the first. And she was even better then. It continued to get better and better. And then, of course, she says, my husband's got to come and see you. Now he's saying, you have more energy than I do. You're running rings around me. I can't keep up. We got too many social engagements out now. I got to get to Dr. Hansen now. So he came in to see me. So this patient of mine, Paige, and most of my patients were surprised to find out that all of these symptoms were related to her hormones. Most women think, okay, yes, I'm going to have hot flashes when I go through menopause, but they have no idea they're going to be so anxious and depressed. If you're low in estrogens, you're going to be depressed. It is a natural antidepressant. And you're going to have, if it gets really severely depressed, you're going to have vaginal dryness. And women don't have any clue. They just think, okay, I just need a little lubricant. And that doesn't work if you have no estrogen. If you have your ovaries removed, whatever worked for somebody else is not going to work for you. So this case was a especially deficient case because she had had a surgery at age 34 and had her ovaries removed, both of them. So she has absolutely no hormones. So she was surprised, I think, to find out, wow, all of these are related to my hormones, and there is an answer. I can get a supplement. You can supplement these hormones that are deficient. And the emotional, a lot of that has to do with not sleeping. So they know you're having hot flashes, that's preventing you from sleeping. But progesterone is another key hormone that she was deficient in that helps to calm your nervous system, and it helps to get you into a deep uh, delta wave sleep. So you are actually able to turn off your mind and get into a deep, physically rejuvenating sleep, which she wasn't having. And if you're not having that as a man or a woman, you're going to have poor cognitive function, poor memory, neurological disorder. You're going to have breakdown of your neurological tissue. Memory starts to fade, and actually the precursing hormone to progesterone is pregnenolone, and Paige was also low in that. So it's all these things go together. They have no idea that there's this treasure trove of hormones that the body normally makes that you give up if you just have everything removed. And so she was so excited to find out there's an answer to all those things.